I'm going to give you this, and now that we've got 3 locations, it's not going to hurt you to reach out just as a backup. But
Good morning, everybody. We're going to go ahead and get the program started. I want to thank everybody for joining us today. I also want to do a special shout out to everybody on the Chamber's YouTube and the Facebook channel as well. So thank you for joining us, guys. My name is Raul. I work for the Surprise Regional Chamber of Commerce. So again, I wanted to thank everybody for coming out today. Today's sponsor, we'll hear a few words from Bobby, but is Arizona State University. A couple of quick things, a couple of quick announcements before we roll. If you look on your everyone's flyer, you'll see that the Chamber has 2 upcoming events, celebrating community events. These are the Chamber's flagship direct-to-consumer events. So we just finished one this last weekend in Sun City Grand. We have 2 more coming up in Sun City and Sun City West. We're also planning to have Ottawa University. Hopefully this summer we'll launch our first indoor and outdoor expo event on their campus. So we'll enjoy and encourage you to attend that if at all possible. If you're a first timer here, please talk to Mary in the back. She's our Vice President of Marketing. If you're interested in membership or some sponsorship opportunities, I'll spend a few minutes visiting with her as well. We appreciate that. We call these events Coffee Connections, and the primary purpose really here is to provide you guys an opportunity to not only network with peers, but to build your connections, and also to learn about important business issues. And so it's an opportunity for you again to meet some key players in the industry. Both our featured guests will be here after the event, so feel free to chat with them. And we all know that healthcare is absolutely critical to our economy, and probably more so in the West Valley than probably any other part of the Phoenix metropolitan area. And it impacts both individuals as well as businesses. So that kind of drives the chamber connection there. And today's conversation is going to probably focus a little bit more heavily on some of the challenges and opportunities that are around workforce development. So we can address some topics there. So Bobby, why don't you come on up? Bobby is with ASU, Public Policy Affairs, and ASU is the sponsor today. And I think you're going to introduce, or at least mention our speakers and then introduce our moderator.
Thank you. Yes, ASU's Edson College of Nursing and Health Innovation and ASU's College of Health Solutions work diligently to meet the needs of employers in a rapidly healthcare field. On your tables are brochures and folders that highlight the various degree offerings and innovative programs that these 2 colleges offer, that graduates are well prepared for these challenging and fulfilling careers. To tell us more about these challenging and fulfilling careers are our featured speakers today. Joe La Rue, President and CEO of Sun Health. Sharon Lind, President and CEO of Banner Boswell and Del Webb Medical Center. And our moderator, Mike LaVault, Mayor of Youngtown. It is my honor to introduce your panel today.
Okay, let me make another introduction. We have a legislator back there, Frank Carroll, member of the House of Representatives for Arizona, running for Senate, right?
Correct.
So you're right in the middle of the campaign. Thank you for being here, sir. Do we have any other elected officials in the room this morning that...
A little shy.
Yeah, a little shy. Well, I'll tell you what, in the middle of a campaign, if they're shy, they're probably in trouble, right? They're probably hiding from something. Okay, so the purpose here today is to, we want to talk with our 2 guests and find out about their organization, and we want to kind of draw on some of their wisdom in terms of where we're going with healthcare in the Northwest Valley. And so, having said that, let me start by, I'm going to ask each of you, if you would just take a couple of minutes, tell us a little bit about your organization yourself, and then we'll talk about what some of the things that you see happening and where we ought to be going. So let me, at the risk of seeming misogynist, but I'm really just chivalrous, I'm going to go to the young woman first, and I'm going to ask you if you would If you would just tell us a little bit about yourself and your organization.
All right. Can you hear me? Okay. No, not on. Now can you hear
There
me?
you go.
Thank you. Thank you, Mike. All right, what a nice introduction. So thank you. Appreciate the opportunity to be here. Sharon Lind and I have been with Banner Health about 10 years now. Shared with some of you, I was up in Nebraska and Colorado, and they asked me to come to the Arizona market about 7 years ago. So I'm really enjoying the winter weather here in the Valley. But I was in the East Valley for a few years, and they tapped me for an assignment up here in the Northwest Valley. So I was as far southeast in the valley as Banner goes, and transferred to Banner Boswell and Del Webb Medical Centers right before COVID. So I had an opportunity, both campuses, 400 plus beds, and about 110 ED bays between both campuses. And so we do a big book of business. Banner is about a $12 billion, going on nearly $13 billion organization. And the book of business I manage between both campuses is net revenue of just under $1 billion. So it's a big footprint for us in the Northwest Valley, Banner, Boswell, and Del Webb. We have a history with our Sun Health partners, as they, along with some community founding fathers, built the Del Webb and Boswell campus. And so there's a legacy there of caring and offering superior health care in the market of Boswell, Sun City, Surprise, Peoria, and the Northwest Valley at Del Webb as well. So I get the opportunity to serve both communities. It's a tale of two cities at times. With Del Webb, a younger demographic sitting in Peoria and Surprise, and then a older demographic sitting in our Sun City community. So it is a great opportunity to be here, to be a part of the community. We want to strengthen, we're attempting to strengthen some of our connections with our community partners. It's part of our way of giving back, but it's a great opportunity to be here and visit with you today about some of the things that we face, and I'm sure many of you are facing similar challenges, and how we position ourselves for the future. So thank you, and I look forward to our next hour together. I'll turn it over to Joe.
Hey, one more comment before you hand over the microphone. You stepped into your current role just before COVID.
Right before COVID.
So what a trial by fire that must have been. I mean, if you can survive that, you're here for good, right?
It was, yes. We spent the first, I think, 3 to almost 4 weeks of March, the first 3 weeks of March, there every day on campus. And it was an opportunity to say, as I was acclimating to both campuses, like, how many ICU beds do we have and where are they? That would be good to see. And how do we go from 24 to 48 to 96? Wow. And just for this room, I want to share, because Mike, you mentioned, we have 400 plus beds. And throughout COVID, the last 2.5 years, during the second peak of COVID, we were at capacity with every single bed in the ER and in the acute space, and double occupancy for COVID patients, and really about a week away from opening up conference rooms, much like this, with cots and partitions. And so the team, we were about a week away. We notified our corporate partners to say, we're gonna need those cots, and we're gonna need IV poles, and we're gonna need partitions, and we need to have our lowest acuity in some of our conference room space if this surge does not calm down. So by the grace of God, surge calmed down, and we started being able to discharge patients and provide more beds available, so we didn't have to get to that. But we were about a week away. So that tells you the magnitude of the care that was delivered. I would share with you, out of 400 beds, there were days that we were discharging upwards of 120 a day and filling the beds that same day. So when you're running 80 to 90 discharges a day on average, up to 120, to make room for patients sitting in the ED, the team performed exceptionally well and beautifully. But they're tired. 2.5 years later, we're tired and they're exhausted. And that's why we hear some of our workforce challenges, because we're not used to being in crisis for that long. But thank you for letting me share.
Thank you, Sharon, appreciate that. Joe, you're up.
Wow, Sharon, that it's incredible, and to think about, that volume of discharges every day. I mean, one discharge. If anybody has been discharged yourself or been with a family member, that takes a lot of time. And to do that volume of discharges every day in a COVID type situation, in a pandemic, I just can't even. My mind can't even get my arms around that. So thank you. I think big round of applause to say thank you to all of the team. I want to say thank you, Raul, for inviting me this morning. Thank you, Bobby, for the introduction, and especially thank you to reintroduce me to Marigold Vault, an old friend. We've done a lot of work together back on the Maricopa Association of Governments years ago, and pre-pandemic, and greatly appreciate your leadership of Youngtown out here in the West Valley. That's very important. For those of you that don't know me or know Sun Health, I'll just talk a little bit about that, because a lot of times I walk in the room just assuming everybody knows Sun Health, and I'm finding out that that's not the case. So I've spent just about my entire adult life out here in the West Valley and out here with Sun Health. Sun Health is an organization, it's a local nonprofit. We like to say we are community owned, because we are, and we're community governed, and we're here for the benefit of the community. We've had this incredible run for 60 years of raising philanthropic dollars and then reinvesting those dollars back into the community. And as Sharon mentioned, early in our life cycle, we were the acute care provider, built and ran the hospitals. Now, I'll talk about that, but we're something different now, and I'll get a little more into that here in a moment. But I think the takeaway point there is, but for the generosity of those, like many of you in this room, many of those that will watch this on the internet, but for the generosity of each and every one of us reinvesting in our community, we would not have a lot of the things that we enjoy today, and have incredible teams like Sharon just described in a time of crisis. It would not exist. And so we've been blessed with that, but I think part of it is because we're community governed. Today, not only do we do the philanthropy, which is very significant, and we're very blessed to have community members still giving of that time, that talent, that treasure, and that testimony to us. We also run 3 life plan communities. If you're not familiar with the life plan community, look us up. It is really the epitome of healthy living, of what happens on our campuses. And when our organization was transitioning out of acute care and said, what do we get into? We said, well, let's get into things that are really empowering individuals to live longer, healthier, happier, more purposeful lives. And the board said, where's that happening? We said, in our life plan communities. And so we said, well, let's really make that a focal point. Today in those communities, I have residents, with us that are anywhere from 60 to 106. They're all on their independent journeys. They're all, discovering life. Bobby, I'm so glad that you're here to introduce us, because one of the key components, and Dennis is here from Ottawa, one of the key components of that healthy living is lifelong learning. It's natural curiosity and lifelong learning. And so we're all in this together. We're all doing this together. In addition to our Lifeline Campuses, we have wellness programming. And that's one of the things that we'll talk about here more about workforce development, is wellness is the key to everything. And so I'll save some of my comments for that for later as we can get into it. I'll just briefly talk on the Lifeline Campuses. So at Colonnade, if you've been there, it's here in the city of Surprise. Beautiful campus right down the street. We are significantly reinvesting in that campus because it's had some, its age of plant is starting to get there that we'd like to bring in, even though it's only about 12 years old, it's not that old of a campus. We also enjoy 100% occupancy on the independent living side. On our health services side, we're not quite there yet, but we are close enough at being 100% that we are looking at how to expand our health center offerings, which is around our assisted living and our memory support. So that'll be the next construction there, and it will become sooner versus later in addition to our refresh. And then beyond that, we will be looking to add more independent living residences, because like I said, we're 100% full. We've got 50 to 60 couples on the wait list asking me every day, when can they join us there. Down at our Loma campus in Litchfield Park, we are just finishing a $35 million expansion there. If you've not been down there, look us up and take a trip. It's beautiful across there. It's going to add 30 more residences. It's for you construction people and math majors, you'd say, wow, that's a lot of investment for $35 million for 30 additional residents. It is, but it is setting up, we're doing a lot of the infrastructure to set up the multiple phases that will come behind that, and there will be many, many multiple phases. Kind of the cool thing that just is happening down there is many of you probably have heard the name Litchfield. Litchfield is the town down there, Litchfield Park, but there is a gentleman that was the namesake, and he came out here in the early 1900s. That's P.W. Litchfield. The city is in possession of his estate on the hill down there, and so we're working with the city, the Litchfield Park Historical Society, Sun Health, and the family to basically bring a cultural center on top of that hilltop. I got the good fortune last night, Sun Health did to host 25 descendants of P.W. Litchfield at an event on the campus last night, all the way from Astoria, Oregon, to Nova Scotia, Canada, and up into Maine. The generation, 4 generations of descendants were there. Great time. They were just checking in, seeing how things are going. But it was nice to see that 4 generations, and the common theme in that 4 generations is they all have a philanthropic mindset, and they all want to give back and be part of the community. And so that was very nice. I say all these things, because I'm very optimistic. I was mentioning this earlier. I'm very optimistic on the future here. It is an incredible future we have here in Arizona. I would not be sitting here if I didn't truly believe that the best years are yet to come for our region. But what I got to tell you, much like Mayor LaVault started us and Sharon did, is our greatest impediment today is workforce, and that is something that's not going to go away anytime soon. And so that's where I think we should spend the rest of our time is talking about the workforce.
Okay, thank you, Joe. Looking at my list here, I want to go there right away. The past 3 years have presented unprecedented challenges to all of us, government, the private sector, but especially in terms of first responders, healthcare, police, and fire. The ability to go out and obtain workers and keep up with the demand and the challenges that you're facing. Those kinds of challenges become monumental. So if you don't mind, Sharon, let's start with you. If you would just talk a little bit about how this pandemic that we've gone through has changed your industry, your facility, and then talk a little bit about things you're doing to. You mentioned the people that are still there are retired. They've been through a long haul here for 3 years. So what are you doing to keep up with the demands and keep enough people coming in to the industry or into your facility just to kind of keep the ship upright? If you wouldn't mind talking about that a little bit.
Yeah, sure, happy to. The team is focused currently on wellness, the health and well-being of not just those we serve, but of each other. So when we think about post-pandemic healthcare industry, and I know many other businesses have been touched as well, but it has changed profoundly. So a lot of focus amongst our leadership team is around what are the needs now? What are the needs now? What do we do next? And what's the future? And the future of healthcare is very bright, and I believe we'll see more innovation and more technology, because the one thing that COVID did, and this is a lot of our conversations too that we're having, is how can we take all of the goodness that came from COVID and best practice and change in how we deliver healthcare and the settings of which we do, how can we take and leverage the innovation and technology and the pathways for that and replicate that in the future? It's the right thing to do, it's the right work, and it also is what the consumer expectation is going to be. Because it opened up a pathway for healthcare that was very different, and so we want to leverage that. So it does change the acute setting as well as then what do we do in some of the ambulatory setting. And creating access to care wherever folks need that care in their journey. So as we do that, repositioning the organization, leveraging the processes and the technology, but also the team. Because we are in the business of serving people, right? You're in the service industry. And so while technology we can leverage certain things from technology and innovation, there is a human connection and aspect to that, whether it's virtually in an e-visit, a wellness visit, or whether they come to the ED and they end up in the OR for something very serious in terms of healthcare. So it's that human connection. And so as we're thinking about the consumer and how they're accessing care now post-pandemic is very different, we focus on the team. And I say that because during COVID and during a pandemic, we're used to, we know how to manage crises, but we generally only manage that for a short period of time, a finite period of time, not over months and years. So it's taught us how to really manage not just what's 3 feet ahead of us, because that's what we've done the last 2.5 years, is really managing what's 3 feet ahead of us. With our team, focus on who are the most important patients that you're concerned about today, and let's deal with that, right? So let's deal with it on a shift to shift, day to day, and not get ahead of ourselves, right? Part of that is there was so much changing in the environment of where they work, and then in their home environment as well, right? So there was no getting away from it. So we encouraged our team throughout pandemic and really post-pandemic is to manage your mindfulness while you're at work, and then when you're at play and you're at rest and you're with family, to make sure that that's how you're spending your time, right? So making sure that we give them space to do that. Part of it in rebuilding, we call this 2022 and into 23, and really beyond is our recovery, rebuilding, recapture. The recapture comes first of being a trusted healthcare advisor, because I believe we've lost that trusted healthcare advisor because the information changed so rapidly that our communities and healthcare, they were uncertain of who and what to trust, right? We want to bring back a safe place for care, a safe place to work, and a great place for care and a great place to work, and being that trusted advisor in healthcare. So that's our new vision for Banner Health, and I know other health systems are coming up with a new day. It's a new day, because healthcare's been changed forever. So how do you create that new day, that space for being a trusted healthcare advisor, where we recapture the confidence and the proficiency and the technical of what consumers expect in healthcare. That's our work, because we want them to seek their medical attention. Go see their primary care physician and come to the hospital when you need to. Follow up with your wellness checks and manage your chronic disease. Folks, we're trying to encourage them to go back and see their physician. It's a safe place for care. And we're here when they need more complex care. We're here. So we're seeing a bit higher acuity because folks have deferred their care and they're waiting. They're cautious. So that's the recapture piece, right? How do we recapture the confidence in being that trusted advisor for our community and our patients? The other is with our team, rebuilding and the recovery with our team. We have lost a lot of healthcare experience, and I'm going to say seasonality at the bedside, because folks have left for a myriad of reasons. They've left to take a sabbatical, to take some time off, to refresh, recharge, and they may or may not re-engage. They've taken travel assignments, right? Our nation has experienced a market rate for nursing that is not sustainable. And so they've gone to travel to take on assignments. They have the flexibility and the ability to do that. We fully respect that. We've brought additional travel labor in at the same time to help support the patient needs of our community. Folks have left healthcare to step away and do something completely different that I've not ever had a chance to do, because they are reflecting. It's a new day for them and their families. They are recovering as well. Or they're stepping away and they're home to to be a virtual nurse. Because as we've ramped up telemedicine and telehealth opportunities, there's new entrants to the market, there's disruption in the market, there's other non-healthcare traditional, I would say non-traditional healthcare entrants to the market where they have an opportunity to be virtual. We have had physicians step away from bedside to be a virtual physician. I could do concierge medicine. I could do home visits. So there are lots of opportunities for our workforce to engage in healthcare very differently and in a non-traditional way. So Banner Health and all of the health systems across the nation we're trying to learn how to be non-traditional in our approach, right? And with that is rebuilding our team. So we have a heavy reliance on new nurse graduates, and most health systems do. So connecting earlier with our programs, our schools, getting to some of those nursing students and offering them CNA, PCA, patient care tech, or patient care assistant role, so that they can have some real work experience while they're in academic, while they're in their program, before they get their RN license. So it's a pathway. We're trying to meet them sooner in their academic career, whether they're an RN role, an LPN role. We've augmented LPNs in the acute setting, which is new for us, learning how they operate at full scope. Externships, where these students are coming in and taking on a role. They get some real work experience. It's a pipeline for talent, and we hope they choose us. Blended with some scholarship opportunities. We have our Banner Health Foundation, we have our Sun Health Foundation. We leverage philanthropy for some of our educational opportunities to pay for their schooling and tuition, to relieve that economic burden of them and their families, so we can pay for their education. Quite honestly, we have scholarship money available. We can't give enough away. So we're telling all of our new nurse grads and our LPNs and our externs and our medical students and our physician residents, we're going to be opening a residency program to have some residents at Boswell and Webb in collaboration with our Banner University partners. So we have these opportunities for physicians and nurses and clinical folks to take an opportunity for these scholarship programs, and we're actually promoting folks to step into the healthcare profession, to get connected with the school, to have those opportunities for these programs, because healthcare is an opportunity to step into. So we are taking time to retrain, re-educate the proficiency at bedside, making sure we have all the resources available for these fresh set of eyes coming in. The benefit of fresh set of eyes is this younger generation, I'm going to say new talent coming in, we want them to be very curious and challenge some of our traditional processes of how we can do it in an efficient way and still be quality and safe. That's the secret sauce, is these folks have a lot of innovative ways. They're curious and they're wanting to learn, and so we ask them to be that advocate for safety and innovation and efficiency, because that's the benefit of bringing in this new team. So it will take not weeks and months, but it will take years for us to recover of what we've lost. In the meantime, blended in with that is our health and wellness programs for our current team members. And we have health and wellness programs for them. We have spiritual counseling, we have chaplains, we have health and wellness coaches, nutritionists, everything body, mind, and spirit to help our team members with their recovery, right, and re-engaging and paying attention to their self-care, their personal care plans, we call them. So they can bring their best self to healthcare, whether they're a housekeeper or culinary or a nurse. It takes the entire team to manage the healthcare needs of the future as we face it. So we're taking an opportunity to make sure that they know the programs available, they are available to them as well as their families. If their families are struggling, there are support for their families. So we want to make sure that we're holistic in that approach and making sure that's available to our team. So that will continue to be our charge. I know Joe has some things to share about what his Sun Health community partners are doing as well. But this is really critical space for us as we're rebuilding our team and bringing in a workforce and developing talent. We're building it, rebuilding it as we go, and that is important for us. We remain to stay focused on safety and quality is the utmost importance in everything we do each day. Thank you.
Thank you. Joe, you want to talk a little bit about, along the same lines, tell us what sorts of challenges have been presented to you with this pandemic we've just gone through, and then how you see that impacting the workforce.
Yes, Mary. And as I listened to Sharon and let a few of those comments sink in, that is, it's going to take years to recapture. That's what we see as well. Total focus is there. And so, the thing that, and I know some of you here are either in companies or business owners, but we've not been at a full workforce for a while in Sun Health. I've probably got 50, 60 positions open in our organization today. If you look on the website, we've not been there for a couple years, and I don't think we're going to be there. Like Sharon said, it's going to be a few years down the road. There is no easy fix here. The other thing that I'll share with Banner, give them some kudos here, because I don't know how many of you travel, do a lot of traveling around our country, go to a lot of other communities, especially smaller communities. But with Banner and other, not just Banner, but there's some other healthcare providers here, they stepped up and did whatever it took to get the healthcare workers here to work in the environment for our community. Many of those workers came from other communities around the country, and if you traveled anywhere, there was places hospitals shut down, wings of hospitals shut down, skilled nursing shut down, a lot of places shut down because they could not attract the workers. The benefit and why I'm so positive is Arizona is still a place that people want to move to. It's a place that people want to work. It's a place that people want to raise their families. Our elected officials have done a great around quality of life and promoting quality of life in Arizona. So for that, I'm very positive. The other thing I would say is early in the pandemic, we did probably the response that everybody else did. Oh, it's about pay, it's about this, it's about that. We increased pay to many of our different folks multiple times through the pandemic, but it's not about pay. At least in our environment, in the healthcare environment, especially the nonprofit environment, because we're either constrained by government funding or we're constrained by what we naturally can raise in our, through our contractual arrangements. I can tell you this past year, I raised some of our revenues greater than we've raised them in 30 plus years. We have to do that to be able to keep at par with wage space. But it's not about just raising wages, because everybody in this environment is raising wages. And what you heard Sharon say is it's really about coming up with all kinds of other things that meet the individual, team member where that team member needs to be met. So the takeaway for me in all of this is really we're going to the space as being as incredibly flexible as we can. That's in flexibility on, what are the hours that an individual works? What are the benefits that the individual values? How do we create programs around our team members so that we can keep them productive in their working environment? It'd be interesting if somebody here says, I didn't experience this, because I know I did in multiple ways. I know my team members did. Through the last 3 years, we have all experienced not only just the stresses of working, we've experienced the stresses of family, not only our immediate family, but our extended family, of our neighbors, of our friends. Everybody has been stressed in this environment, and every time you have that stress and it becomes overwhelming, what happens? Somebody ends up dropping out of the workforce, so they reduce their hours, or they do something of this nature. So we're trying to create tools that we're there to help not only our team members, but everybody else out in the greater community, whether that's through wellness coordination, whether that's through training. Sharon mentioned the scholarship funds. We have the Warren D. Rupp Scholarship Fund, which is significant. An individual in this community wanted to pay it forward, dedicated multiple millions of dollars to scholarships. We award hundreds of thousands of dollars in scholarships. What we tell parents is that if you want help getting your kids through school, affiliate them with one of our organizations, and we can make that happen. If you want to go back for education and training, please do so. We've linked with all the high schools. We've linked with Westmec here. on career development, those things. We do clinical rotations for the CNA programs. You know, there are enough channels now that anybody that wants to be educated, we can figure out a way to get them educated at either, you know, no tuition cost or a very reduced, a very reasonable tuition cost. So I think that's, you know, something we're going to do. But what I would start having you think about is there is not enough younger population or that, say, you know, 40 and below crowd that can fill all of the, you know, the spots that are around the country. We are in a global, if you look at the top 15 developed countries in the globe, they all need workers. They are all scrambling for workforce. You know, they're all competing globally. There's about 4 countries around the globe that have an excess workforce. But those are countries that really have migration issues. So we've got to think this out on how we get the source of labor to the spot in an economical way. So one of the things that we're working on as we think about all this, we say, where is there this tremendous resource of labor that's not, you know, it's untapped? And as you look around, it's that 50 and better, you know, population. You know, if you think about the baby boomers and the Gen Xers who are either in retirement or approaching retirement, surveys show that most people don't want to retire. Most people want to stay purposeful. Most people want to stay active in some way. So we're looking through our organization to say which jobs can we break down, and instead of having 1 full-time FTE, do we have 2 part-time FTEs? Do we have 3 that job share? How do we break this down? I'll give you a recent example. I have a phenomenal wellness coordination expert in our organization who's approaching retirement and said, you know, I really need to step away. I want to retire. I'll give you plenty of time to find somebody. So we've been out interviewing and looking, and we're having a real difficult time. This person's like, you know, I really need to, you know, step away. And so somebody that worked for us years ago, who's been retired for 5 years, called and said, I really don't want, you know, a full-time gig, but I really want to get back in the game. I loved what I did for you guys. I love being part of the Sunhill family. And so, you know, luckily the management staff said, my gosh, would you come back for part-time? Absolutely. Shared that with the individual who wanted to step away and said, oh, we didn't know you do part-time. I do part-time as well. So now we're filling positions with combination of part-time folks who are extremely experienced, you know the community very well, know the hospital system very well. And so we're really going to go after, you know, that 50 and better population very significantly. The other area that we're really focused on, and I don't want to sound sexist, but really the women of this country are our future. And I see a lot of males in the audience. I hope it doesn't hurt your egos, but if you think about it, who are the ones that are going to school more than anybody else? It's women. You know, who are the ones that are in the work, who need to be in the work, who are coming into the workforce, historically not been in the workforce, or coming in the workforce and are coming big time? It's the women. Who are the ones that are most challenged when stresses happen in the family environment? It's women. So how do we change up our policies and procedures to really make sure that we're doing all we can to not only educate and train, you know, the women of our country, but really then engage them in the workforce and make sure that when things pop up in their life, we're there to help them and get over that stress and keep them in the workforce. I think that's the key. I don't want to get political, but I think recently some of the policies that are coming around this country probably are not looking at it the way I do, but and we'll get over it and we'll figure it out because we always do as a country. But I think women are the key. And then I'll just close on, you know, I think I'll close on 2 other things. One is immigration. I know it's not a popular topic, but we do not have enough people in this country to fill all the slots. And so we have to figure out how we're going to, as a country, engage in immigration globally to make sure that you know, we have that that source of labor that we all desperately need. I can tell you, when I have employee town halls, my workforce is already global. I've got almost every country represented. I've got multiple language, our primary languages in our organization. We're already a global, you know, entity right here in your own backyard with our workforce, and we're going to be more so in the future. But I think, and Sharon said it, I think the key to all of that comes back to wellness. And it comes back to each and every one of us being purposeful about the decisions we make so that we can make sure that we're keeping ourselves at optimal performance, at they're not, our mindset, our heart set, our physical, it all comes back to making those daily choices so that we can stay in that workforce. Or if something happens in our family, we're there for our family. We're there to handle the stress. Or we all have, parents or grandparents that are aging and need somebody alongside them to walk that journey. So it's so many things that we need to do, but it all comes back to our own individual illness. If we're not individually healthy, you're not going to be a whole lot of help to all of those around you, and then ultimately you're going to be in the ER at one of our hospitals, and part of this patient load. So I would encourage everyone to really get on that wellness train if you're not on it. It's a great ride to be on, and someday you will be that 106-year-old that has a social calendar in one of our communities, and when they tell me their calendar, I'm embarrassed because they are more social, more active, more out there than I am at 106.
Thank you, Joe. You said a number of things that I think are important to note. First of all, I think you're reaching out to the older community, especially people, old guys like me, retirees. I mean, in this state, there's a wealth of talent that it resides in people that have retired from some other place, and they're, many of them are anxious and look forward to getting back in the game. So I think that's a smart thing to do.
Mayor, I hate to cut you off, but you said a term that and I know that you're a politician, so older is not.
Please don't call me that.
Old guys, we got to get rid of. I used to do that all the time, and I'm trying to get it out of my vocabulary. It's 50 and better. We're 50 and better.
Well, listen, the only way I can get by with that is because I'm an old guy.
Well,
Anyway, then you said a couple of other things. You both talked about the velocity of change in our lives these days, and I tell people all the time, look, the only constant in our lives going forward is change. You better figure out how to embrace it, or you're going to get bowled over. And then the other thing you said I thought that was remarkable, you talked about how salary is not everything. People want quality of life. And yeah, they want enough money to live a comfortable lifestyle, but they want good schools for their kids, they want good transportation to get around the valley, they want crime-free streets. All those things are important. So I want to ask, and I'm going to go kind of go that direction next. As you know, we're going to elect a new governor next month, and we're going to have a pretty radically changed legislature. I think, right, Frank? I mean, we're going to get a bunch of new members in the legislature, and there will be some changes at the local level, mayor, city councils as well. What can government do, especially at the state and the local level? What can government do to help in your industry going forward? Because I know those challenges are there, and so talk a little bit about that and how that would play out for you. You want to go first?
I'd be happy to go.
Okay, go ahead, Joe.
I'd be happy to go first, because I do have some thoughts, and at the risk of maybe upsetting, I'll try to keep it. So I really got mixed emotions about this election. It's probably one that I've, as I think back 30 plus years, I've always been very optimistic about the elections and fresh faces and the tune. I have mixed emotions about this one. I'm just being vulnerable in front of all of you, and probably gonna, make some of my staff nervous. And it's because the messaging in this election, and I know it's been getting different, it is just too harsh for me, and it's just always, we're the good guys, and it doesn't matter which aisle you sit on. It's we're the good guys, they're the bad guys, we're the way, they're not the way. And in this country, we have always really figured out the right, answer. It's taken us some time, but we've always gotten there. You just go back through history and look at all the challenges we've had. We've always, figured it out at some point. But we did it by sitting down around the table, having, great civil discourse, acknowledging where we disagree, really understanding that disagreement. Because I find when I'm brought in to, talk to people, it really comes down to they just don't understand each other. They haven't really taken the time to understand the position. And so what I would hope out of this election is we get people seated that put all this rhetoric behind us and all the stuff that's been going on and sit around the table, because these are big issues that we're talking about. You know, charging our workforce and getting this mental health. We didn't even touch on mental health, but we're all struggling. Whether you know it or not, you're all probably struggling with some form of mental health and mental illness right now. The trauma that all of us have gone through.
Some more than others.
Some more than others. And I don't want to say the old guys, but there's been so much trauma in the last couple of years that we've all suppressed because we're in a crisis. It's going to come out. You know, you can't run from it forever. So we got to get serious dialogue around mental health issues. We got to get serious dialogue with whoever's elected, serious dialogue around immigration issues, serious dialogue around so many issues. That's what whether it's at the local level, the regional level, the state, or the federal level, there's got to be that dialogue. And there's got to be that openness and receptiveness to learn as much about the other side and what they truly believe in, and then how we can work together and give and take and come up with that result.
Thank you. Sharon?
Yeah, thank you, Joe. And you know, I think about it from a perspective. My first response would be Dr. Margie Bessel is our chief medical officer, and she has spent a lot of time at the governor's office and with some of our state officials around just how to manage through pandemic and the health regulations associated with that as we follow CDC guideline, et cetera. So she's really the voice and face for Banner Health with that connection to our state government. More locally, I tend to have, and our CEOs do within our markets, locally we have connections that we rely on with our agencies, chambers, legislature, state representatives. Any opportunity we have to be in a forum like this, or we get an opportunity to have perhaps Debbie Lesko out to our market. It's an open invitation for any of our government partners to come and just take a walkthrough. And the team loves to showcase all the good that they do in caring for our communities. So getting an opportunity, I think that's a benefit to have any of our governmental officials, local, statewide, actually come and visit and see the campuses and see where the real work, the healthcare is being delivered, and get a sense for the team's perspective and what we're providing. Advocacy around less legislation, right? Focus on truly what matters, but making sure that at the state level and the federal level that we're advocating for programs that are really needed in our communities. We've cut back on reimbursement. I get balancing the budget, I get the deficit where we're at, but investment in programs that really truly matter. We are underfunded for mental health. We speak of mental health a bit tongue-in-cheek because mental health is healthcare, and we all deal with some level of mental health, right? Some are in a better place, but we have a need for additional funding for programs that can really reach the community around health and wellness. We do a community health needs assessment, all of our campuses do in every market. We do it every 3 years. And we provide, what are the social determinants of health, right? We've talked about that, Joe and I have. What are the social determinants of health care? And how does that relate to the communities we serve? And how does it relate to the patients? And also to our workforce, right? So a lot of focus on, at the state level, how could there be funding available for programs around substance abuse, mental health, nutrition and wellness? How do we create some wellness activities in the community that will promote good eating habits and tackle some of the obesity, right? Some of the unhealthy habits that we have. Cooking, right? How do we manage nutrition in the home, right? Because so much is easily and convenient through fast food and other mechanisms. So how do we support families and communities, the schools, and how do we make that connection? As a healthcare partner, and with some of our state officials, we have programs in schools, high schools, elementary, middle school, high school, and secondary education, community colleges, and university settings, where we can impact this to a great deal. It's just a matter of coming together in some collaborative. I would love to see a coalition around this and just do a pilot study of a blue zone, a healthy community in some segment of this valley. So there's opportunities to do that. We spoke about that a little bit with Dennis and our Ottawa University partners. But how do we do that and create the funding and the resources around it, and how do we set up a community to pilot something like that? That's the innovation, right? That's the connection between what we do at the state level and what we do locally in serving our community and what we do within healthcare. The one thing I would add is we have the opportunity to have state surveyors out. And it could be a routine or non-routine survey. It could be initiated by a complaint, a concern that a patient had, or it could just be part of a routine. And what we're finding is there is a level of collaboration, Mayor, that I would say is of benefit to our health systems and our communities. We have a Joint Commission accreditation, and we choose to have that. We pay for that. We have surveyors come out. But having the state surveyors come out and get an opportunity to look at our processes and what we're doing to drive safe, quality, reliable care, they have a wealth of knowledge and information because they see other providers in other settings, not just acute care. And so having the ability to have that collaboration and that collegiality at that level, because they can share best practices. So when they come and visit our campuses and they come to the healthcare system, we all share that. We had state surveyors out, and here's what they focused on. And here's the learning opportunities that came from that. And here's what they shared with us. And then we scale that. We share that information across our communities, across our banner campuses, so that we can leverage that. So as we continue to have conversations at Dr. Margie Bessel and at our senior level leader and locally, is as much as we can drive that collaboration with the surveyors and those state officials to really benefit the best care that we can provide to folks in Arizona. Because we are seeing multi-generations, and we are seeing a diverse population of which we serve. Joe spoke about that previously. We have a lot of spiritual care needs that are very different than they were 10, 20 years ago. So we want to make sure from body, mind, spirit, we're caring for that diverse population. And the best way we can do that is in cooperation with a lot of agencies, many other agencies in our communities, as well as our state officials.
Thank you. You know, Mayor, if Sharon hit on a great idea to give an example of something that worked very well with the government. Let me give an example. So Governor Ducey created a task force for the long-term care environment back in the pandemic. That's a great example of collaboration with a lot of different stakeholders onto that task force. We met, periodically and talked about some rules about how we were going to deal with the pandemic and our environments, which were very confusing because you had CMS on the federal level, and you had the state level, you had local level, you had county level, had a lot of different things. As you look at that and say that's a great example of collaboration, and it was the governor's office, it was the state Department of Health, it was the Maricopa County Department of Health, and many of the providers. We were hamstrung a little bit with that collaboration because of the pandemic, and we couldn't invite people onto the campus and say, this is really what's going on, because some people had misconceptions on what we actually do. So we would continue that collaboration outside this pandemic so people could really learn, like Sharon said, invite people out to the, different decision makers out to our facilities, out to our campuses, see what's really going on. So if we ever get into this situation again, we're not trying to educate at the same time we're trying to come up with policies and decisions. And so that would be a specific ask, is to continue that type of working in collaboration.
Yeah, and thank you, Joe. I would add just one thing to that, as we partnered with Joe and others in that space, that came out of necessity during pandemic. And so part of our challenge as community leaders is to say, what models can we put in place and be very purposeful and planful around it so that we can have that even more elevated execution and impact in what we do. So I think that provided a model for what needed to be done during surge and pandemic to get patients where they needed to be post-acute, post-discharge, and optimizing the assets we had in the valley. But it would be a great opportunity to continue those types of models with those coalitions and influence what we can going forward. That would be a welcome opportunity.
Thank you. I think those are, both of you have made great comments about that. And I think this notion of collaboration, working together at all levels of government, I think it's key to our future. We all know that Arizona faces some massive challenges going forward: water challenges, air quality challenges, transportation, education. The word existential is way overused, but those really are existential challenges for this state. And I think the more successful we are at garnering and cultivating those collaborative workings, I think the more successful we'll be in terms of providing a good quality of life for our residents. I've always believed, and I've been a mayor now for far longer than I thought I would ever be mayor. I've been mayor, just got elected to another 4-year term. If I fill that, it'll be 20 years. But I've always believed as an elected official that my most important role was to enhance quality of life for my residents. Because without quality of life, nothing else really matters. And so I think it's important that we figure out ways to work together, collaborate together, in not just your area, but in all the fundamental areas that we face here in the state. I want to ask you something too. We've talked a little bit about some of the challenges you're facing in your industry, and we've talked about some about how technology now is beginning to impact in a pretty fundamental way the way people are receiving care. I know my last 2 visits with my doctor have been telemed visits. So, and that gets to another issue, and that is, what do we do to keep paying for our health care in this country? People seem to think that the health care bucket of money is bottomless. It's not. It's finite, and at some point we have to make decisions about how those dollars get spent. And so I know traditionally in this country, we've spent most of our healthcare dollars at the end of life. And usually, when you get to that point and you're spending all that money, a lot of the reason for that is because of the lifestyle that people have lived throughout their lives to that point. What can we do, or what can you do in your industry to help shift some of that thinking, catching the younger generations now, and even I'll call them seasoned citizens now instead of old guys, right? Even the seasoned citizens, what kinds of things can you do in your industry to help people make the right kind of choices, the right kind of healthy choices going forward? You want to go first, Sharon?
Sure. Yeah, happy to. So, as we think about healthcare today, what needs to be done now, next, and in the future, part of that is leveraging technology and innovation. I think that hits a segment of some of our consumers that have an appreciation for that. I know for some of you, I've got a 20 and 30-year-old, and they're like, Mom, I can just do a visit on my phone. I don't need to go to the doctor and sit in the waiting room, like the traditional go sit in the waiting room, wait to be called, to have something simple. And so that there is a segment of our population that is very comfortable with telemedicine, telehealth, e-visits, and can demonstrate, they can articulate well, they're comfortable with it, and you can do that literally 24/7. They can have an e-visit at 10 o'clock at night, or 2 in the morning if they need to. There is a segment of population, as we think about, we have a persona We call her Sophia, and she is a real person, but she is our persona of healthcare, Sophia. And we chose Sophia because the women in the family generally direct the healthcare decisions. And they also manage the parents and their extended family. They're looked upon to manage, right, their in-laws, senior care. And so they're the trusted advisor in the family for healthcare. So Sophia, we want to make it easy for Sophia to access care. So oftentimes, it's really understanding where Sophia is in her healthcare journey, because she may have youngsters that want that e-visit and telemedicine visit, and I'll go to the doctor when I need concussion testing because I play football and sports medicine, and this is where my interests are. So how do we align healthcare with where their interests and needs are, right, for health and well-being, and promote wellness? And then how do we meet Sophia? And then how do we care for her aging parents and her aging in-laws? So there's a set of consumers that want that face-to-face and that connection. We have to be agile, we have to be quality, convenient, and affordable. And so how do you meet the affordability when the technology is so blooming expensive, right? So at Banner Health, and most systems are, health systems, are trying to find a partner. Who do we partner with, right? It's something we can't create, we don't have an internal competency, right? So how do we partner with an industry leader that is strong in that technology and have a joint venture or partnership with? So we're looking at new entrants in the market and partners that can be a subset of what we deliver that is beyond our acute care thinking. And that's where I think the future of healthcare will be driven to, is if we don't have that within our portfolio of competency, how do I partner with someone to bring that to us? And that's what Banner is working on. And we will pilot, we are happy to pilot certain innovation and see how it went and get the consumer feedback. The focus groups and the consumer feedback is the most valuable piece of information. And then we can make a decision whether we leverage that for a long-term initiative or whether we choose not to and go to a different platform. So looking at those platforms, bringing in what's affordable and convenient and efficient, and I think too, having, I'm gonna get back to the state and the federal level reimbursement around that. Because we have so often a physician saying, well, I don't get paid for that. It may be the right thing to do, and it may be convenient and quality, but we need the reimbursement. Our codes and regulations are antiquated a bit, and they need to be brought to future in terms of how healthcare is delivered today, and will be 10 years from now. And so we can have the regulation, the reimbursement, and that pathway to create that innovative and different delivery model. Then the consumer is in a better position, and we are as well, and we can reduce some of the costs.
Okay, thank you. But how are we doing on time? Can I go to Joe for a few minutes and then?
Got a couple minutes.
Okay, Joe?
You know, I was going to say Sharon gave such a great response. I kind of, much of that, I think everybody that's got a company today needs to be thinking like Banner, in that we all need to be a part technology company. But we cannot hire, you know, I just hired some more technology folks, and they're hard to find. And we're partnered with, you know, different schools and places to find, you know, qualified individuals. But everybody needs to be a part technology company and look for that partner to come in and help show the way. One of the things that well, I'll give you an example. So in the senior living area, 2 decades ago, people rarely showed up at your doorstep with a device. And then they started coming in with cell phones for emergency purposes. 10 years ago, they started coming in with a smartphone. Now, most of the people that are moving in with us are coming with multiple devices. Multiple. I'm looking over here at the mayor who's got a smartwatch, and it looks pretty smart the way that thing is really going off on his wrist there. They're coming with multiple devices, and they know how to use it. And they want to use it, they want to continue using it. So we have to adapt to the consumer. We've got to be a part technology company. One of the things we did, because our industry is really behind the rest of the world on this, is we've invested into a fund that is specifically geared towards startups in our space, so that as us being a partner in that fund, we're then able to preview early technologies that are out in the piloting stage across the country to see whether or not we want to adapt that technology. One of the cute ones we brought in as a pilot, if you've been in our communities, is a robot server. Her name's Rosie. Rosie, the robot who serves. And so there's robots just going around the dining room and things like that. There's so much else out there that we're going to look at, including all the wearables. I mean, the future is all of these wearables that are monitoring us each and every day and then going someplace that then the healthcare provider that knows what they're doing with that data can look at it. Because one of the biggest issues is when you take mom to the appointment and he says, well, how's this been going? If you're not there with mom, what mom is telling the physician is not accurate. You know, you may think it is, mom will tell you it is, it's not. And so then, you know, the course of treatment ends up being a little bit off. And then mom ends up finding a way to the emergency room because what mom is doing. But wouldn't it be better if all of that data went to a healthcare provider, you know, in real time, and they could screen and say, oh, here's exactly what's going on. That's where we'll be someday. We're already headed there, but all of us will be there someday.
By the way, the worst thing about these smartwatches is every time I get a text or an email or a phone call, it dings on my watch, so I'm looking at it, and I'm sure people are thinking, well, this guy's in a hurry to get out of there, and I'm not really, I'm just kind of keeping up with what's going on. So thank you for that. Raul, how are we doing on time?
Wrap up shortly.
We're there, right?
Yeah, we're there, just about, yeah.
Okay, did you have any last comments that you wanted to make? I appreciate you being here. It's been very informative, by the way. Jen?
Yeah, thank you, Mayor, and it's a great opportunity to be here. I'm sure that we can make some connections and have some further dialogue. It is an opportunity to really change the future around not just healthcare industry and senior care, but within the business of where you reside. I think from a workforce perspective, having a team, our focus truly is on having a team that understands their why and their purpose. Because folks got into healthcare for a reason. So we're trying to leverage that and focus not just what's 3 feet ahead of us today, but what about next week, and what about next year, next month, next year? And what about the future, right, of where we need to be headed? As we look towards wellness and innovation and technology, wearables and home care models, we're looking at an opportunity to keep folks out of the hospital, right, out of the acute care setting. And that's really our objective. And so how do we create that space? And some of our employees, there's a portion of our workforce that is a very different thinking and very innovative, and yet still can help us with being safe and quality and reliable. So leveraging those new set of eyes and helping them be engaged in decisions and pilots, programs, and the model of care or your business delivery is so important. Education, if you're in the space of education, whatever your space is, making sure that you're listening to your workforce because they have some bright ideas. And so what matters most to them? How can we continue to advance and influence our industries of where we serve, getting back to the whys, and that's really the constituents, consumers, the community we serve. That's really why we're in this, to serve our communities and bring our best selves and doing it every single day. So the team, as we focus on that, we get a lot of engagement around their purpose and why, and having activities that really drive that to promote our health and well-being. So thank you for the opportunity. Joe, last comments?
Joe, yeah, last comment.
You know, Mayor, I'm going to deviate a little bit because you said something that I want everybody in this room as a takeaway is, and whoever views this on the internet, you said that most of the healthcare dollars are spent in the last few years of their life, and all of the data, bears that out and does. So what I would encourage everybody in this room to do, if you haven't had conversations with all your loved ones about what your end of life looks like, you really need to do that. And it's not too soon to have that conversation. There's a book out there called 5 Wishes. and if you don't know where to get one, I call my office, we'll give them to you. But it's to help you start having that conversation with, about yourself, about your loved one, about your fathers, your parents, your grandparents, doesn't matter. And it really walks you through helping that person, describe what their journey in life is like through that end of life. And what we find, and I've seen this for all the years I've been in around the hospital systems, is that a crisis happens at that critical moment because people haven't had that conversation, they haven't thought about it, they haven't talked about it, so they go into crisis mode. Wouldn't it be better if you had all that talked about, so that when things happen, you know kind of somewhat what to do? You'll never be totally prepared, but you'll be better prepared. So I would encourage everyone to do that. And then in addition to that, you've got to, because some of those things are hard concepts, you've got to wrap in a healthcare professional, a wellness coordinator, or a transition specialist, or somebody that can explain some of the nuances there. Because in this case, it's not a one conversation. It is a constant conversation that you'll have, and it doesn't have to all be done in one day. It can happen over years. I would encourage everyone to do that, because that will start having. I can tell you the majority of people that I have those conversations with don't say, "Oh, at the 11th hour of my life, throw all the healthcare you can at me." That's not the answer they have. It's, here's what I would like to happen at this moment in time. So that would be my wish from everybody here. I would say, close by saying I'm very optimistic about the future, as you can tell. Also know that those that are more optimistic tend to have a little healthier lifestyle. So keep that in mind. There is a reason for all that optimism. But I'm very optimistic, and I couldn't be more thankful for our partners here, Raul, for providing us, for Bobby introducing us in ASU. Great organization. That organization is just phenomenal. Ottawa on this campus, you guys are just rocking. Thank you for that. Mayor Laval, for your leadership is superb, and then Sharon, I've told this story a couple times, so it's probably not news here, but when Peter Fine, who is the CEO over all of Banner, shook it up out here and said they're sending Sharon, I was like, oh my gosh, because I knew Sharon was East Valley. I said, oh, they're sending us another East Valley out to the West Valley. I was like, oh my God. But I gotta tell you, this community, our West Valley out here, we've been blessed to have Sharon come out here. She gets what the community's about. She gets community health care. She gets community needs. She gets engaging with the community. So Sharon, thank you. I told Peter this a couple times. Thank you, Peter, for sending Sharon our way. Now, please don't take her anywhere else. But thank you, Sharon, for being a part of this.
Okay, thank you to our two guests. Very informative on a topic that is going to continue to be an important part of all of our lives going forward. And thanks to Raul and Mary and Bobby. Raul and Mary, thank you for what you do with the Chamber, a vital part of the community. You know how I feel about the private sector. I want to create the most fertile commercial district I can in my town, and I want my government to get the hell out of the way and let people do business. So thank you for what you're doing. Thank you for coming out, folks. And we're going to stick around for a few minutes afterwards if there are questions. Okay, thank you. Take care.